Dupilumab. Now, Dupilumab was approved in a condition known as atopic dermatitis. Atopic dermatitis. Now, first of all, what happens in atopic dermatitis is there is overactivity of these two interleukins, interleukin 4 and interleukin 13. Now, both interleukin 4 and interleukin 13, they will bind to their receptors. Interleukin 4 receptor, interleukin 13 receptor. But both these receptors have a one common subunit, which is interleukin 4 receptor alpha. Interleukin 4 receptor alpha is a common subunit in interleukin 4 as well as interleukin 13. Dupilumab is a monoclonal antibody against this receptor, interleukin 4 alpha. So, when Dupilumab is given, both these interleukin 4 as well as interleukin 13 cannot work. So, when they are not able to work, the atopic dermatitis can be treated. Clear? Now, question is how to remember, and again you can remember it is a monoclonal antibody. MAB means monoclonal antibody against interleukin. IL means interleukin. And which interleukin? The name start with the D, and we know D is the fourth letter, A, B, C, D. So, it is against interleukin 4 receptor. Fourth letter, interleukin 4 receptor. And the name start with the D means it is used for treatment of dermatitis, atopic dermatitis. Clear?